Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Today I'm here with Dr. Theodore Macnow, and we're talking about carbon monoxide poisoning. Doctor, what is carbon monoxide?
So carbon monoxide is a poisonous gas. It's indetectable to our senses. So you can't taste it, it doesn't have a color, it doesn't have an odor, and it's formed when fossil fuels don't burn cleanly. And a lot of equipment in our house uses fossil fuels. For example, oil or gas-powered heating, gas-powered dryers, gas-powered stoves, fireplaces, wood-burning stoves, and our automobiles.
What are the symptoms and why is it so dangerous?
So the symptoms vary in people. The most common symptoms are headache, nausea, or vomiting, but people can also experience dizziness, sleepiness, or shortness of breath. And it's so dangerous because it eventually can lead to a coma or even death. And so if you don't recognize the exposure and think you may have gotten a virus, you may just sit there and continue to inhale carbon monoxide.
What populations are most vulnerable to carbon monoxide poisoning?
Everyone's vulnerable to carbon monoxide. I'd say two populations that are especially vulnerable are children and the elderly. And children may be a bit more vulnerable because they can accumulate carbon monoxide faster than adults. They also may not recognize they're having symptoms or recognize what the potential source of the exposure is, so they can't vocalize it. Similarly, they may not be able to walk, so they can't escape the exposure. I think elderly are vulnerable as well. They often live alone. They may be having symptoms and no one else is there to also experience those symptoms, and they too may not be able to exit their home.
How can someone protect their family from carbon monoxide poisoning?
The most important way to protect your family is first to prevent carbon monoxide from being in your house to begin with. So make sure to have your heating systems and other gas-powered systems inspected annually to make sure that they're functioning properly. Make sure to have carbon monoxide alarms in your house. They should be on every level of the home and within 15 feet of every bedroom. And if you have a garage inside your house, make sure it's in the garage as well. And then these should also be tested monthly to ensure they're functioning properly. When snow falls here in New England, take care to shovel out the heating exhaust and dryer outlets, as well as your car exhaust, to make sure that carbon monoxide has a place to escape. And when you're shoveling out your car, never idle your car, and definitely don't have a child or someone else sitting in the nice warm car while you're shoveling out.
How quickly can carbon monoxide poisoning occur, and what can I do if I suspect someone in my family has it?
Carbon monoxide poisoning can occur quickly, and it depends on the level in the air as to how quickly you'll have symptoms and how quickly that may progress to more serious condition. If you ever suspect carbon monoxide poisoning, the most important thing to do would be to get out of your house or get out of the room where you think there is carbon monoxide, and then let the fire department come and clear the house.
What is the treatment for carbon monoxide poisoning?
Carbon monoxide is treated first by getting away from the exposure. That's the most important thing. When someone comes to the emergency department with carbon monoxide poisoning, we give them oxygen, which helps to get rid of the carbon monoxide in the body more quickly, and we'll keep them in the emergency department or even the hospital on oxygen until the carbon monoxide level is normal and the patient has absolutely no symptoms. If you ever hear your carbon monoxide alarm go off, don't ignore it. Carbon monoxide is indetectable. It could be in this room with us right now. We'd have no idea. So get out of your house and call the fire department and let them figure out if your house has carbon monoxide.